Callen-Lorde Community Health Center was born out of the Stonewall Uprising, what we know as the birth of the modern LGBTQ rights movement. And so even though we started as a small, scrappy, volunteer-run clinic, and we are now grown into this fully fledged, federally qualified healthcare center, I think advocacy, activism, and social justice is in our organizational DNA.
Callen-Lorde is known around the world for their superior transgender and gender non-binary care. We are transforming institutions and impacting policy to support our transgender community. For example, a couple of years ago, New York state law changed and said that any private insurance company or Medicaid insurance company that was operating in New York state had to cover gender-confirming care and gender-affirming surgery. In addition to suggesting changes to their policies, we've been able to hear from our patients the issues that they're having when people are not following the policies that they've put in place. So we're able to report to these insurance companies specific examples of the ways that they're not following their policies and get those changed so that the next person that comes down the line won't have the same problem.
Every day inside the walls of Callen-Lorde, we provide hundreds of HIV and sexual transmitted infection screenings and tests.
Outside the clinic, we work with lawmakers and regulators to end the HIV epidemic in New York, making sure that our state and local public health laws and codes support the broadest access to HIV testing, to PrEP, and to treatment that our healthcare system will allow.
So working with allies around the state, we've been able to expand access for HIV treatment and prevention treatment to young people. That means that a 15-year-old now who may not have support of their parents or caregivers can come in and access HIV treatment or prevention treatment in close consultation with their provider.
We're helping patients and community members enroll in health insurance in New York State every single day, and we continue to provide care for those who are unable to secure health insurance. This parallels our work with legislators in DC fighting to keep and strengthen access to affordable care, as well as our annual efforts to make sure New York State supports primary care for the insured and uninsured.
At Callen-Lorde, we believe that true liberation must include all of our LGBTQ communities and our families having adequate access to culturally competent and comprehensive health care in all of its forms, and that public policy advocacy is a really important part of that. We even know that connecting people to volunteer and other civic opportunities is a health intervention unto itself. All forms of our advocacy, direct and indirect, connect deeply to the health of our communities. Whether we're talking about the triumphant legal victories, gaining civil rights for the LGBTQ communities, or the tweaks to legislation and regulation that open up access to health care, or the multi-year funding investments that really allow us to keep doing this life-saving work. It all connects deeply and helps to improve the health and well-being of the communities that we serve.